But when it comes to pharmacies putting shots in arms, the Ministry of Health says that regions with high COVID-19 rates were prioritized. But of the 21 pharmacies administering the AstraZeneca vaccine here in Hamilton, none are in the lower part of the city, leaving many wondering why. Dale Manucdoc has the details.
The dark blue spots on this map show where COVID-19 infection rates are highest. The pins indicate pharmacies approved to administer the AstraZeneca vaccine. Many were quick to sound the alarm that none of the approved locations were in the downtown core or lower part of the city.
What do you notice about this map?
That it's only half of, well, no, it's entirety of the city. It's mostly down the escarpment.
There's nothing downtown or down the lower city.
You know, you look at where the cases are, they're all down there. So that's wrong.
It kind of goes against what's been happening, right, for the people that are at greater risk.
Local politicians were also confused. City Councillor Narinder Nan tweeting, "Why have local advisory and public health do the work of triangulating highest need areas if it is simply to be ignored?"
Why they're so concentrated on the mountain, I'm not sure, but I do know that it's just part of an ongoing process and you will see expansion.
The lack of having pharmacies in the lower city, I think, is an oversight that needs to be corrected, and I'll certainly be advocating for that. Having said that, they're going to be gradually expanding to include some 69 pharmacies right across the city.
The mayor says the final approval of pharmacy locations was made by the provincial government after input from Hamilton Public Health and the Ontario Pharmacists Association.
The public health unit identifies priority postal codes, so we look at that and we come up with a recommended list. The ministry then approves that and it goes forward.
Ontario Pharmacists Association CEO Justin Bates says over the next few weeks, 800 more pharmacies will be included province-wide and the problem areas will be addressed.
Phase 3, we're going to have a specific emphasis on downtown to make sure that there's at least a handful of pharmacies to serve the population.
He says some lower Hamilton pharmacies were approached to participate but weren't ready.
And it's not a big deal that they're outside of the downtown core, but what are we doing to facilitate bringing people from the core to those areas to give vaccines?
Bates says the Ontario Pharmacists Association is advocating that pharmacies have the ability to go mobile.
You can't always rely on people coming into a mass immunization clinic or a pharmacy or a doctor's office. I think we've seen the value of taking it to high-risk neighborhoods and certainly homebound patients as well.
Now, Donna Skelly noted that while you can't get vaccinated at a pharmacy in Lower Hamilton, that doesn't mean you can't book one on the mountain. In fact, now that she's eligible, she booked one at the pharmacy of her choice for tomorrow. But Mayor Fred Eisenberg did acknowledge that downtown core is more densely populated, it is more vulnerable, it is a marginalized community that deserves equal access to vaccines. I also spoke with MP Matthew Green, who along with Andrea Horvath and every inner city councillor are outraged by this vaccine rollout. Green says that by the time this area gets their vaccines at pharmacies, more damage will be done to an often forgotten community.